NIH Public Access Policy. Since 2008, the National Institutes of Health Public Access Policy has been promoting public access to NIH-funded research by requiring that its researchers deposit their publications in PubMed Central. However, this policy allowed for a 12-month embargo on the release of these publications, which meant the public may not be able to access them until 12 months after the publication appeared in a journal. In August 2022, the Office of Science and Technology Policy released a memo instructing all federal agencies to develop policies that would allow immediate access to funded research without the embargo period. These new policies for public access to both publications and research data will go into effect throughout 2025. The NIH has already implemented the requirements for public access to data through its 2023 Data Management and Sharing Policy. To address requirements for publications, the 2024 Public Access Policy removes the 12-month embargo period for publications with NIH funding. It was originally set to go into effect at the end of calendar year 2025, but in April, the NIH announced the start time for this policy would be accelerated and has now gone into effect as of July 1, 2025. The new policy applies to all manuscripts accepted for publication on or after July 1, regardless of when the grant was initiated. The primary change for this policy is the removal of the 12-month embargo period, which means that authors will need to take steps to ensure their manuscripts are immediately available in PubMed Central. There are several key actions you can take as an NIH-supported researcher to ensure your compliance with this new policy. First, work with your publisher. Make sure that you clearly state any NIH funding associated with your publications at the time of submission. This will help ensure that your publisher knows you are NIH funded and will need to comply with the NIH Public Access Policy. You will also want to select an appropriate licensing model when signing your author's agreement to make sure you retain the necessary rights to post a copy of your manuscript to PubMed Central. Be aware that some publishers may be adding new fees for the right to submit accepted manuscripts to a repository. While fees associated with open access publishing remain an allowable cost, fees charged solely for the purpose of submitting to PubMed Central are not allowable. When selecting a journal to submit to, make sure you review their publishing models first to confirm you will not end up encountering unexpected costs. Second, submit your manuscript to PubMed Central. Initiate the submission of your article to PMC upon acceptance of your article. Processing an author's final version manuscript can take some time, and your goal is to have it in place when the journal publication goes live. The exact steps of the submission process will vary depending on the specific journal and publisher you are working with, so you will want to identify which submission method they use early in the process. Third, monitor your compliance. Track the compliance of your publications proactively using the My Bibliography tool. My Bibliography, part of your My NCBI account, is required to manage and report the compliance of all manuscripts associated with your NIH funding. By regularly monitoring your compliance status, you can avoid delays and possible issues with noncompliance down the road. As of July 2025, the overall process for maintaining compliance with the new public access policy appears to be the same as the previous policy. The only major change is the compressed timeline due to the immediate release of publications without an embargo. And to reiterate, this new policy applies to manuscripts that are accepted on or after July 1, 2025, even if the grant was awarded earlier. For more information on the NIH Public Access Policy and how to maintain your compliance, check out the NIH Sharing webpage or our NIH Public Access Policy Guide. Investigators and departmental staff who have questions about complying with the policy can contact OSP Pub Access Compliance at osu.edu.